welcome our next innovation showcase, um, Kirthika and Dr. John Chuo from Vital Start Health, and they're going to be talking about how VR is going to help with mental health, particularly in providing an equitable platform to everyone and access to everyone. Please go ahead.
Great to be here, Pallavi. Hold on, let me just share the screen here very quickly. And a great talk there, Zinnia. That was just amazing. Good luck to you. I know we're all in that same space, and I feel equally like you do to help moms everywhere. So yeah, let me just share my screen quickly. Hello, mamas. Walk with me through this journey in well-being. Oops.
Welcome. You are at the right place.
Absolutely, you are at the right place. At Vital Start Health, we are proud to support moms everywhere in their journey through pregnancy and postpartum. We've all heard of the four vital signs: pulse, respiratory rate, body pressure, and body temperature. Today, I'm going to unveil the fifth, the vital sign for well being by Vital Start. Our initial focus is on maternal mental health. I think I'm preaching to the choir here, but definitely it's an area that is, need that has some clear gaps. It's something that is close to my heart and clearly an area where we all can do much more. We have heard of many folks who have had a tough pregnancy and postpartum, but did you know close to 70,000 women each year are going through near death experiences in pregnancy and postpartum? And one third of that is attributed to mental health. I know because I was one of them. I have personally been through postpartum depression with my firstborn when I lost my mom. And I went through the fear, the stigma, and the feeling that they'll take my child away from me. I'm passionate to be able to utilize technology and all the skills that we can get to tackle this problem through Vital Start. I'm a Wharton alum with a deep background in technology and business and a DARPA Award winner, and I'm excited to present Vital Start to you today.
Thanks, Kirthika. As a man and as a husband, I'm just simply amazed by the incredible strength and resilience of women who choose to carry children through pregnancy. It is one of the very few things in our lives that alters its course in a very profound way, and it's one of those key branch points in our journey through life. And as a physician, I've always thought that while we treat physical conditions of pregnancy very well, we don't quite do a great job with the mental wellness of pregnant moms, and for that matter, fathers, as well as the families. I remember counseling, talking to parents in the NICU in my role as a neonatologist, and talking to them about their baby and how their babies are doing. And really, through body language and facial expressions, really felt the stress and anxiety that they feel. And I always hoped that there was a way that we can help them from that perspective. And so, in fact, it's a very tough and broad challenge. And so NICUs today are now starting to hire psychologists and licensed mental health professionals on their staff, taking on this challenge from starting from the time the mother is pregnant to the time she goes home. Fortunately, in most cases, they go home with their babies, and in some very tragic cases, they don't go home with their babies. And so more and more now, even outside of the NICU, in our very own communities, moms and are seeing mental health professionals to help them through this pregnancy to postpartum when they're in the NICU, seeking them to help manage the stress, anxiety. And they are at a very high risk, as you've seen, through our last presentation today, our presentation, that there's a varying degree of risk for postpartum depression. So Paul Bedalton had really taught me something, and he said one time that a system is perfectly designed to give the results that it gives. So the tools that are currently in place to help mental health professionals or actually to do their job are actually the same tool that has been there for centuries. Are we really satisfied with the results that those tools are giving? And I wasn't, and I know many of us are not. And so through our advisory groups of mental health professionals, psychologists, and therapists, they have really helped us develop a new way to use technology of today and build a innovative tool that will be used by mental health professionals, and it's called Courage. Next slide. So Courage is a all-in-one mental health virtual therapy platform, and it allows mental health professionals to use mixed reality in therapy sessions. And this platform has been designed with inputs from psychologists, human factors experts, and patients. And it allows the mental health professional to send their clients, moms, a number of mental health assessment tools via a secure platform that they complete. And the information they learn from to appropriate Courage scenarios for the virtual aspect of the session. They'll conduct a traditional telemedicine remote therapy session, but then immerse their clients into a virtual therapy. That mental health professional can control how the scenarios are played through the virtual headsets that the moms would wear. The moms, by the way, can also use their own phone and put it into a virtual cardboard box that costs about $5, so that even those who could not afford a expensive or even a moderately expensive price headset could use their own phone to do this. And the mental health professionals can pause the scenarios in the middle and ask the moms, how are you feeling? How do you feel about this? And the library that they can choose from ranges from relaxation and mindfulness tools, what we call stress mitigation scenarios, to those that are specific to situations of pregnancy that are designed to trigger a controlled level of stress, so that mental health professional can observe the moms directly and treat them right at the moment in that session. So the moms therefore learn to use relaxation and mindfulness techniques for the exact triggers that makes them stressed and anxious in the first place. So next slide, please. So there are a few things that make us a bit different. And so one of them is our well-being profile. This well-being profile is a dashboard that helps the client, the mom, and their mental health professional monitor progress over time together with objective data. And based on their needs, that health professional can customize the profile, choosing from a library of assessment tools that they can use to customize how they assess that particular mom. The Courage Innovation Mental Health Partners has two parts to it. So the first part is a network of mental health professionals that we have who are trained by us on how to integrate VR, AR into their practice safely while sustaining high quality care. They're also a think tank which contributes to the evolution of Courage. We know that things change, technology changes, and so we've designed the Courage architecture so that with evolution in mind, so that it can change with the latest vetted technology and functions that brings the maximum value to the moms as well as to their health professionals. And the second part of this partner is actually the moms and dads. It is critical for us to make sure that Courage is easy to use right at the where they're receiving care. And so the moms and dads are encouraged to join us as partners to evolve courage as well. And there's growing library of VR/AR scenarios will contain content that also will include specific conditions that postpartum and pregnant moms face, such as gestational diabetes, and if their babies were born with a congenital condition and needed to go to the NICU, we'll have scenarios to address those things, those situations as well. So how it works, next slide please, is that a mom will take a customized assessment tool, and based on that, this mental health professional will be able to then customize the therapy session as well as the scenarios that they will present and work with the mom in order to reduce stress, teach them stress mitigation techniques, and then at the right moment when they're ready, induce some of triggers stress using these scenarios, and so that they can monitor and teach them how to use the techniques they've learned earlier to manage stress and anxiety. So go ahead, Kirthika, back to you.
Yes, thanks, John. To provide a clinically guided, targeted system that can have effective outcomes, it was clear to us that we needed to have some studies and clinical validation, and we've done that successfully at a leading institution here in Philadelphia. And what we learned from that study was that parents found VR to be extremely visceral and engaging, and to a large level, they said that the stress levels would also be coming down. The practitioners were really excited that they now had a tool for experiential practice, as well as to directly observe how their patients were coping with stresses. We know what moms are going through. We understand really clearly, and hence we want to meet the parents where they are. We have a system that will handhold the mom through this journey and provide different tiers of care, whether it's personalized mindfulness or then VR-based therapy for targeted conditions that they're going through. We are enabling a very affordable system here where the VR headset is thrown in as part of the service itself and is not something that we need to charge a lot for. We have a huge goal in mind. We want to impact 1 million women in the next 10 years, and actually, if it were me, in the next 5 years. Our strategic vision is to be the virtual medicine provider for optimal mental health. And of course, maternal mental health is on top of our list. We have an exemplary team helping us in this venture from Penn, Drexel, Penn, and we're part of the Microsoft Startups program, the Science Center, and we are a University of Pennsylvania company. Both John and I have been really pleased with our platform provider, Persistent, and we're excited to be part of the Comcast Connect program. I hope you'll join us and help us in this tremendous journey that we're on. Join us in courage and help us develop the vital sign for well-being by Vital Start. Thank you.
Thank you.